Good day, everyone. You're welcome to another edition of my program called Health Talk with Queen Nikki. What's going to be our topic today is going to be self-medication and allergy. Okay, as per popular demand for this week, I have a lot of people ask me in my inbox about allergy, self-medication. I've done, this video, I've done it on my YouTube channel, and I'm still just gonna buttress and talk about it. Should we be doing self-medication, especially for my followers, fans in Africa? No, 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 no. Self-medication is a no. No, you need to follow your doctor's advice and direction. The doctor is the only one that can prescribe medication, except we have nurse practitioner. There's people we call nurse practitioner. They are advanced nurses, and they can also write prescription. Now, when you get prescription from doctors, you can now take it to the chemist or the pharmacy where they will fill the prescription for you and they will tell you the direction. Now, can a nurse tell you the direction on how can they interpret it? Yet the nurse can direct you, not prescribe, direct you in making sure this is the dosage you can take, how often, as per the doctor's order. Okay, I hope I've explained this one. So now, I heard people saying if they have headache in Africa, they can just go to the chemist, just grab some medication and use it. Yes, there are some medication that we call over-the-counter medication. Over-the-counter medication is medication whereby it's just, let's say, minor thing. You have headache, you have pain, body pain, you just want to take Fensic, you want to take Motrin, Tylenol, all those basic ones. You don't need doctor prescription for that. Now, but the bottle, you still have to follow the direction on the bottle, the label area that said maybe you can take 2 tablets as per adult every 6 hours or every 8 hours, and don't overuse it. That's where the self-medication comes. Don't overuse it. Now, when we talk about self-medication, there are some medication that I see some individual talking, selling online. And it's very dangerous. Medication like HIV, retroviral medication, and all those tough medication that need doctor prescription. Even weight loss, weight loss medication. There are some weight loss medication that you need doctor supervision to be able to use, because they have to frequently check your lab to make sure that your liver is intact, your kidney is intact before you can continue to take this medication. These are powerful medication that need doctor direction to be able to take it. Now, let's go further. Allergy. I've done a video about allergy medication and allergy in children. For me, if you have a newborn baby and you are giving milk, instead of breast milk, there are some parents that they still alternate both breast milk and milk, but breast milk is the best. Breastfeeding is the best if you can do it exclusively. But there are some baby, things happen like that. If you have I would recommend that for formula, you introduce one formula at a time, so that if there is issue with allergy, you can quickly identify it. So that way you can call the pediatrician for that baby. They can switch the formula around. What are the things that we look for? Diarrhea in children, runny nose, diarrhea, difficult in breathing, change of color, and other things that you notice in the newborn baby that you firstly introduce formula to. Please stop it, call your pediatrician, and then take the baby there so they can further do testing to make sure that the baby is not allergic to the formula. Now, I have this question. People ask me this question: can adults have allergy? Yes, adults can have allergy with medication, with food. Now let's talk about food. For food, baby children from 1 year old upward too can have allergy to food. That's why for toddler from 1 year old to 3 year old, if you're newly introducing one food, they will tell you, even 6 month old, they will tell you to introduce one food at a time. Let's say for a 6 month old, you want to introduce egg or an apple. First of all, try egg and see if the baby does not have allergy to egg, and then you proceed to apple. So you do one baby food at a time. That's why you will have to do it with a 1 year old, a toddler to 3 year old. So make sure you do one food at a time, so that way you'll be able to know if they're allergic to that food. And if they have allergy to that food, when you're sending them to school, make sure you notify their teacher that there is an allergy after you confirm with that your child pediatrician doctor that your child have allergy. There is a wristband that they usually put on the child's hand to school, or you just notify their provider in school, like their teacher or school nurse, that hey, my child has allergy to it. So other children eating that similar food beside your children will not be possible, because even smelling it can be dangerous. Okay. And then the doctor will be able to order rescued preventive measure that you can do, like EpiPen. Okay, if there's need for that, or maybe Benadryl and all the stuff. Okay, let's go for that. Now, for adult, can adult have allergy to medication? Yes, as simple as over-the-counter medication. Yes, an adult can have allergy to it. This happened recently. I know one of my relatives that traveled to Nigeria, and she ate yam, just regular yam. Now, it's not that she doesn't eat yam, but that particular yam she ate, she made her mouth swollen, and it was so severe that they have to give medication. Now, let me tell you one thing about all this thing. It might not be the yam precisely, it might be the preservative in that particular yam. So that's why we have to be very careful when we are eating. The good thing is she did not add any other thing. She was certain that it was that yam that she ate that was able to give the doctor narrative, clear picture of what she eat. That's why I was like, if you're trying new food or you travel to African country, be careful of what you eat and make sure that what you're eating, you know it, and your body change, you can identify it to know if it's allergy or not. Now, with medication, if you have allergy to medication, which is usually itchy, your height will be itchy, your back of throat will be itchy, you'll be having sweaty, difficult in breathing, sweaty hands, sweaty palm, restlessness, it comes in various ways, but most of the time you will see body change color, haze, difficult in breathing, mostly those are the significant sign of allergy. Stop the medication immediately. Call your provider so they can look into it. With allergy, with food medication, from children to adulthood, there is what we call allergy center, where you can go. They will do allergy testing to know which food you are allergic to and which medication you are allergic to, and then they will teach you how to use EpiPen or Benadryl and all those stuff, so you can rescue yourself. Allergy reaction can be deadly. It can be deadly, but it's also manageable with education and knowing what you are allergic to, and take necessary prevention. Okay, how do you take necessary prevention? Like I always say, you can go to the doctor's office and get pamphlet and read online, also with educative program from doctors and nurses all over the world, on social media that talks about licensed nurses that talk about allergy reaction, where you can get empowered. Allergy reaction is something that we can be treatable, but at the same time, knowledge is power. And remember, health is wealth. I hope hope you've learned. If you want further video, you can go to my YouTube at www.healthtalkqueen@gmail.com. You can email me that, or go to my YouTube channel Health Talk Queen 1 to learn more about it. Till I see you guys in my next video, remain blessed and follow this button for more video on TikTok, Instagram, YouTube, and Facebook. Bye bye.